So today we are going to continue talking about the 5 risk factors into metabolic syndrome. And so we are focusing on high blood pressure or hypertension. So the name is interchangeable.
Correct.
And so if you can tell us some of those myths that we've heard throughout our many years of our professions, but also what many patients out there are probably hearing in regards to high blood pressure. Right?
Correct, yeah. So hypertension is also one of the risk factors for metabolic syndrome that leads to problems with cardiovascular disease, which is the #1 killer in humans. It is estimated that around 75 million people here in the United States suffer from high blood pressure. So it is a very important topic to talk about. And there are many myths that have been said are linked or causal of high blood pressure. I'll tell you 3 of them towards the end of the video. But basically, it's important that we let the viewers know that we need to fix the hypertension because it leads to chronic illness, heart attacks, and stroke.
And so for many years we've been told that salt is so bad for us, and so we've demonized it, and people have eliminated it from their diets, or tried other types of salts because it's according to whatever news are out there, it's better. What can you tell us about salt?
So basically, salt's not the enemy. It was never really the cause of high blood pressure. What really does cause high blood pressure is insulin resistance. And I'm going to explain how that works. But we talked about in previous videos where insulin resistance comes from, and that's from a diet of carbohydrates. We consume too many carbohydrates here in the standard American diet, and this is why we're seeing so many cases of high blood pressure.
So, okay, so then salt is not the
enemy.
issue.
Nope.
It's not the enemy, but sugars are, or carbohydrates are. So what exactly happens inside our body that causes this high blood pressure?
So yes, this is exactly what happens. When you consume carbohydrates, sugar goes up, insulin has to go up to get the sugar. Insulin then goes to your kidneys and tells your kidneys, hold on to salt, we need the salt. So we have to dilute the salt because high salt in the blood is not good either. It has to be diluted. So blood volume goes up, thus in turn, your blood pressure goes up. So it's not the salt, it's not a problem until insulin resistance that tells the kidneys to hold on to sodium.
But that itself, that process in our body itself, because sodium is mentioned, right,
Correct.
in that process. So this is kind of how salt became the enemy.
The enemy, yeah.
Right?
And it was a hypothesis that they thought it was the salt the problem. The truth is that there have been no double-blind placebo-controlled studies, which are the gold standard, to prove a hypothesis. So in science and medicine, we can have a hypothesis, but what do we have to do to, for that hypothesis? We have to prove it. And there is no real study that has proven that salt is a problem.
So it seems like we have this recurrent theme that carbs, sugar, processed foods are the enemy. Those are the things that we need to start avoiding or limiting, from our diet. But nobody really talks about that. If patients are diagnosed with these conditions, it's always like, well, let me put you on a medication instead of, you may want to think about changing your lifestyle.
Correct.
And that's not what's prescribed. It's we're given a prescription to fix it.
Now, I want you to know, so patients, very rare to actually have to need a blood pressure medication if they make this lifestyle change, if they make the change in the diet, the carbohydrate consumption. So any medical doctor, a provider that tells you that you are stuck with a antihypertensive or high blood pressure medication the rest of your life, it's just not true. It can be fixed.
Well, that's great. I mean, I wouldn't want to, take a medication for the rest of my life just to control my blood pressure when I know that I can make other changes in my lifestyle to help myself and avoid having to be on a medication, right?
Correct.
Because it's not only is it expensive, but it probably brings on other side effects because we're taking this medication that is affecting other things, which leads to other prescriptions or being prescribed other things, right? And so it's like this vicious cycle.
Yeah. What a lot of people don't know, and a lot of providers don't know, is that the medications, some of these antihypertensive medications can actually deplete your body of important minerals and vitamins. So yes, you'll take the medication for high blood pressure, thus leading to other problems, and you're not going to be feeling well. So it's important that the viewers know that they can be taken off these medications, and they need to talk to their doctor. Obviously, this is just information and not medical advice. You need to talk to your professional, your medical provider about this, but you can be taken off these medications. You just have to decrease the carbohydrates.
So think about this, you know, if you're on this medication and you're not getting any better, your blood pressure's staying the same, you know, I don't know, possibly even rising, you know, if you haven't changed other habits, then you need to stop right now and ask yourself, what do I need to do, and what questions do I need to go and ask, right? Because obviously the medication isn't solving the condition, right?
Correct.
So what are these? Yeah, go ahead.
Just to add on that, also stress is important. Stress, we got to decrease stress, because stress will increase your cortisol, epinephrine, norepinephrine, all your stress hormones. That will cause your blood pressure to go up. The other thing is sleep. Sleep's important, because if you don't get sleep, you'll have these hormones elevated as well. And another thing, sleep apnea. And sleep apnea is usually caused by obesity, and if you're not sleeping well either, you're going to have high blood pressure. So you got to get those things fixed as well.
Yeah, it's so important to be able to, you know, have that control and the ability, right, to control your stress, which I have a video on. It's very brief, but I will, you know, make more on that.
Correct.
But the sleep is so important.
Absolutely.
You know. So Hoy, what can we leave the audience with? Actually, you mentioned we were gonna give them the 3 myths.
The 3 myths, yeah. The 3 myths that have been thought for many years to be causing high blood pressure. One of them we already talked about, salt. Salt's not the problem, but just make sure though, you don't get a refined salt. That actually can have sugar in it. Just get like a granulated salt or a Himalayan salt, but not refined. The other one is caffeine. Caffeine actually does not cause high blood pressure. Transiently, it can increase it, meaning, you know, when you take it, it may go up a couple points, but that goes away as the effect goes down, but it's not enough to diagnose high blood pressure. And the last one is smoking. Although I do not condone smoking for many, many, many reasons, it actually doesn't cause high blood pressure. But the audience knows now what causes high blood pressure, and really it's insulin resistance, and that's what we need to fix in order to get that blood pressure
So
control.
limit our sugar, carbohydrate intake, and our processed foods. The recurrent theme throughout every video that we've had on how bad sugars and carbohydrates are for us.
Well, yeah, the refined kind, the processed kind, you know, but yes.
Okay, well, thank you so much, and see you here next time.